Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great pain relieving exercise for those degenerative disc diseases of the lower back. It's a mobilization exercise that's sure to please. Stay tuned. So degenerative disc disease of the lower back is usually associated with some type of stiffness or tightness or immobility, not only in disc fibers to be able to bend and stretch, but also the associated joints at that level of your spine and the soft tissue structures like the facet capsules and the ligaments and tendons and muscles. So we're going to teach you today a three-phase or three-directional mobilization exercise that's great for warming the disc up, whether you first wake up and your back feels stiff, or after a long car ride, or sitting when you're compressing and putting 12 to 13 times your body weight on those discs in the seated position. Anytime you're having pain, anytime you're having stiffness, this is a great way to stimulate nerves to undo some of the pain, get some motion and circulation in the spinal articular structures, and help alleviate what you've been feeling. So this can be done either in the face up or the hands and knee position. We'll go through the hands and knee position first. Basically what you're going to do is you're going to explore a range of motion that feels comfortable by raising your tailbone upwards, okay, towards your back, which will increase the arch of your lower back. You'll bring your tail up as far as is comfortable and hold that for 2 seconds. Then you're going to tuck your tail under and hold that as far as you can without aggravating any of your pain for 2 seconds. And you're going to cycle back and forth, 2 seconds in each direction. Now, as you do that, you want to make sure you're correcting any type of posture or alignment issue you have. If you have a tendency to have one hip high or twist your rib cage or lean your rib cage to one side, you want to make sure you're dealing with a nice square body structure, right? So your ribs aren't leaning or twisting, or your hip isn't swinging up. So you'd cycle back and forth with tail under and then tail up, holding for 2 seconds at each range for about 4 to 10 repetitions, going back and forth. Then you'll use a side-to-side shift. Let me show you what that would look like. We're going to elongate one hip down, away from the ribs, as the other side swings up. Again, you're going to go to a comfortable degree, hold that for 2 seconds, and then swing the opposite way. Hip down on the opposite side, hip up on the opposite side. Now, if you're feeling any pain with this, for instance, if you're swinging this way, that means you're going too far and compressing this side of your back. So you only want to go far enough that's not painful. And again, 2 seconds to each side will be great for you. You can also do a little spinal rotation, which is lifting one hip up on one side as far as you can, hold for 2 seconds, and then lifting the other hip up for 2 seconds. Do you see that? This can also be done in the face-up position, which is more comfortable for many people, especially if you also have knee problems. The first mobilization, you'd bring the tail up, which would arch the lower back, again, 2 seconds, and then tail under, 2 seconds. And again, each direction, both forward, backward, and then the hip down on one side, okay, line face up, 2 seconds, 2 seconds. Each position is thinking about your alignment issues and making sure you're not going into a range of motion that causes pain. And finally, the twist, one side and another. It doesn't need a lot of motion. Okay? You're not trying to necessarily stretch things out with mobilization. You're just providing a little motion at the lower back across the discs and the joints, holding for 2 seconds. And that's stimulating mechanoreceptive nerves, which are picking up motion. They're getting to your central nervous system faster than the pain or nociceptive nerves. That helps you to decrease the pain. It also helps to pump a little blood and get a little motion going in those spinal segments, which many times is missing in degenerative disc problems. So give that a try. I'm sure you'll enjoy both as a warm-up for exercise or walking or starting your day, and as a pain-relieving exercise. If you enjoy this exercise and would like some others, please subscribe to our channel. We've got lots of great analysis and corrective exercises for degenerative disc problems. Also, if you'd like to leave a comment in terms of any ideas of videos you'd like to see or any suggestions, we'll entertain those as well. More products and videos and We even have all kinds of corrective books and exercise programs are available at the painfreeandfit.com website. Hope you enjoy.